from Dysautonomia International. Without further ado, please welcome Cristina Billy from Canine Partners for Life, which is a nonprofit organization dedicated to training service dogs, home companion dogs, and residential companion dogs to assist individuals who have a wide range of disabilities. So welcome, Cristina. Thank you for being here.
Thank you for having me. So again, my name is Cristina Billy, and I'm the Graduate Support Coordinator at Canine Partners for Life. We are a nonprofit organization, and we are located in Cochranville, Pennsylvania. So I'm going to start off this presentation telling you a little bit about our organization, but also get into the different types of assistance dogs and the laws surrounding them. So at CPL, our mission is to increase the independence and quality of life of individuals with physical, developmental, and cognitive disabilities, or who are in other situations of need. We achieve our mission by providing and sustaining professionally trained service and companion dogs. And at Canine Partners, we also have a very extensive follow-up program. So as Graduate Support Coordinator, that is my role in supporting our teams for the entirety or the lifetime of their partnership. So it's really wonderful to be there with our recipients every step of the way. So Canine Partners was founded in 1989, and we are actually one of the first organizations to be accredited by Assistance Dogs International. We are currently one of 136, and we get reevaluated every 5 years. So essentially what that means is we are an organization that upholds the highest of standards in the assistance dogs industry. So it's truly a great achievement to have this accreditation. At the end of the presentation, I will talk a little bit more about how you might go about acquiring a service dog if this is something that you're interested in. But I typically suggest starting through Assistance Dogs International's website. You can filter there and find what programs might be best suited for your needs. You don't have to have a service dog through an accredited organization, but as mentioned, that's a good place to start. So at CPL and most assistance dogs organizations, the training will begin as early as some say birth. We do a lot of socialization with our puppies within the first 8 weeks of their life. At Canine Partners, we have our own whelping center, and we have our own breeding program, but we will also work with other ADI organizations through a breeding cooperative so that we can select certain genetics for health and temperament to ensure that we have a happy, healthy, and confident dog that's able to have a long working career. Once they leave our whelping center, they will work with a variety of volunteers, both in a community puppy home, but also with inmate prison handlers at a prison puppy raising program. At Canine Partners, we have 5 working on 6 prisons that are part of our program, and it's really been a great experience. The dogs have a lot of great opportunities to work on basic skills, manners, socialization, going out on field trips with community puppy home volunteers in the area. And when they come back to Canine Partners around 14 months old, they work with our professional trainers to work on advanced skills and really fine tune some of that, as well as continue with their socialization and get out in the world, because we try to have our dogs gain as many experiences as possible. When they go with their forever partner, they're with them 24/7. So we want to make sure that they can tolerate a wide range of experiences, going to baseball games, a fireworks show, places that might have more stimulation than a pet dog can typically handle. We like to make sure that our dogs are stress-free and confident and comfortable working for their partner so that they can do the most efficient job possible. They're usually about 2.5 years old by the time that they're placed with their recipient. A working career can be between 8 and 10 years, so they might be 10 or 11 by the time that they retire. We like to give our dogs some time to be a pet, kick back and relax and just enjoy a different journey in life. Our service dogs love what they do, but they also really appreciate that time to rest. So at Canine Partners, we have a couple different types of dogs that we provide. We have companion dogs, which are dogs that do not have public access. They are home companion dogs that are placed with an individual and their family. A lot of times they are young children with developmental disabilities, and they just provide a lot of comfort and companionship within the home setting. They are allowed anywhere pet dogs are allowed, but they do not have public access the way that our full service dogs do. We have courthouse companions, so they work in district attorney's offices and places like that. They live with a faculty member and go to work with them every day. Again, they don't have general public access, but they do have access in their quote unquote workplace. They will work and comfort victims of crime and help them testify. They are also allowed in the courtroom underneath the witness stand, and it really has provided a lot of ease for these testimonies. We also have residential companion dogs, so they will live in nursing homes and places like that. Again, they'll go home with a faculty member and go to work with them every day, and they provide that companionship, and they will visit with the residents in that facility. We also have our full service dogs. So these are the dogs that do have public access. We provide mobility and support dogs as well as medical alert. In my next slide, we'll talk a little bit more about those, but other types of assistance dogs as well that aren't necessarily provided by CPL. So the different types of assistance dogs, one thing to remember as we go down this list is all of these dogs are task trained. And that is something that's important to remember because it is the defining factor between a trained dog and an untrained dog like an ESA, an emotional support animal that does not have public access. So a guide dog is one of the first service dogs and most well known, and they are dogs that work for individuals who are blind or visually impaired. So their tasks might be navigating curbs, crosswalks, that sort of stuff. We also have hearing dogs that are working for individuals who are deaf or hard of hearing. They may alert to different sounds, such as your keys dropping on the ground, somebody knocking on the door, a fire alarm going off. They are able to be trained to essentially any sound that might be relevant to your environment. Our mobility dogs that we provide at Canine Partners and other organizations, they support individuals while walking, climbing stairs, transferring. They might also provide physical tasks such as picking up an item, opening a door, closing a door, turning on and off lights, carrying items for a longer period of time. We also have medical alert and response dogs. So they can alert to a seizure, a cardiac episode, diabetes, low blood sugar, narcolepsy, and more. We've even had dogs that have alerted to migraines, latex allergies, you name it. Alerts might look a little bit different per dog and what it is that they're alerting to. Sometimes an alert might be a very intense stare. It might be what others might think is disobedience. The dog stops in their track and refuses to do your command. They might cut you off while walking, nudge you with their nose. And if you aren't listening, they'll really up the ante and maybe, paw at you or bark at you if you're really not paying attention and it's becoming more urgent that you need to get to a safe place. Some of the physical tasks that our mobility dogs will do are also helpful for individuals that have alert dogs. Certain tasks like bending down to pick up an item can really take a lot of energy out of our recipients. So having a dog that can perform that for you can really help you conserve energy throughout the day. And sometimes being able to conserve that energy will lessen the frequency of such episodes. We also have psychiatric service dogs. They may alert to panic attacks, anxiety, PTSD. They can remind a person to take their medication. They can also perform tasks such as checking rooms before entering or stopping the person from self-harm. Individuals with PTSD might also utilize a dog to be a barrier between them and someone who is approaching. They may be able to go into a room and turn on all of the lights so the individual is not walking into a dark space. there's a lot of different tasks that these dogs can do for their person. There are also autism service dogs. These are a little bit lesser known. There's not quite as many of them at the moment, but they're able to alert to stimming behaviors. They can stop movements that could be harmful to the person. They can improve the person's social skills and perform physical tasks for them. So again, all of these dogs are task trained. The ADA does not recognize emotional support or therapy dogs as service animals because they're not trained specifically to assist someone with a disability. And we're going to talk a little bit in the next slide about what the difference is between those three types of dogs. And then we're going to get a bit more into detail about the ADA law itself. Okay, so all three of these dogs you might consider some type of assistance animal, and they're all really great. They have a super awesome function, but they're very different in many ways as well. So a service dog, as mentioned, is the only one of the three that is covered by the ADA. They are the only ones where their individuals have the right to bring them into public establishments. A therapy dog is only allowed necessarily in a place where they're given permission for that volunteer role of going into a nursing home or hospital to visit people. An emotional support animal is essentially a pet. They don't have any necessary training requirements. So with that, service dogs and therapy dogs, because they do go out into public, they do have to be able to tolerate a wide variety of experiences, environments, and people. Both service dogs and emotional support animals are considered reasonable accommodations when it comes to housing, where someone might be able to request accommodation to modify the no pets policy that is in place. A therapy dog, because they are not, their owner is not necessarily the recipient of their function, more so they're the volunteer that brings the dog to nursing homes and places like that as a volunteer. They don't have that same right to ask for a reasonable accommodation and housing. The service dog's primary function is to provide emotional support through companionship. Service dogs and therapy dogs, while that is a really great benefit, that is not their primary function. A service dog is trained to assist just one person, whereas a therapy dog will go and visit multiple people in a facility. But then the last one, I think this is just fun. They're all good boys and girls. So they're all really great dogs, but they are different in many ways. So to talk a bit more about the Americans with Disabilities Act, also known as the ADA, it was passed in 1990 and it was then revised in 2010. So this requires covered entities to make reasonable accommodations in their policies, practices, or procedures in order to afford persons with disabilities equal access to their programs. So in reference to service dogs, a reasonable accommodation would be modifying the no pet policy. So the ADA, the Title I covers employment, Title II covers state and local government, and Title III covers public accommodations and private entities. So Title II and III essentially covers any place that provides goods and services to the general public. Anywhere the general public is allowed to go, a service dog is typically allowed to go. So under the ADA, a service dog is defined as a dog that has been individually trained to do work or perform tasks for an individual with a disability. The tasks performed by the dog must be directly related to the person's disability. Now, in the past, this has also included miniature horses. Title II and III only specify dogs, but there are still in many cases, covered entities do have to require a miniature horse, but there are some circumstances in which they would be able to deny them, especially depending on the nature of the goods and services and the animal's size and weight and that sort of stuff. Miniature horses are typically used for guide work. Just a fun fact. But as mentioned again here, they are specifically task trained. So a couple of those tasks, I had another video prepared, but it wasn't working. So I had a couple of short clips of one of the dogs that I have trained doing a few tasks herself. So I just wanted to demonstrate a couple of the things that they can do. So this is Jane. Here's another one. It's a little bit echoey in the room that I filmed it, so I apologize if that hurt anybody's ears. One more. So that is Jane. She was a dog that I raised for another organization called Warrior Canine Connection. She actually did not pass the program. Not all dogs are meant to be service dogs, and she is the type of dog that would much rather cuddle up with you on the couch. So I actually got the opportunity to adopt her. And now she is in the other room and she is loving life, let me just tell you. So let me go ahead and go to the next slide. Okay. So let's talk a little bit about handlers' rights. So we know what a service dog is now, defined under the ADA law. But in situations where it's not obvious that a dog is a service animal, staff may only ask two specific questions. One, is the dog a service animal required because of a disability? Two, what work or task has the dog been trained to perform? Staff, however, cannot ask for any type of medical documentation, identification, or proof of training for the dog, or ask that the dog demonstrate any of its tasks. This is something that's important to note because there has been a rising issue with fake service dogs, people going out just because they want to take their pets places. I love my dogs. I would love to take them everywhere, but it's just not suitable for them to be in those types of environments. And it really infringes on the rights of those with disabilities that do utilize a service dog for their independence. So one of the misconceptions is that a dog must have a registration or an ID as a service dog. They do not. As a part of an accredited organization, we do have our dogs complete public access tests every 1 to 2 years, and they do get a laminated card stating so, but it is not a requirement. A lot of the things that might pop up when you Google, how can I get a service dog? Are scams. It really just comes down to the definition of a service dog under law and how they are working in that environment, if it is safe for them to be there, and if they are providing the services necessary for their person. A dog, however, may be excluded if their presence would fundamentally alter the nature of the goods or programs, or if the dog is out of control and the handler does not take effective actions to control it. So say the dog is barking or showing any type of aggression, but also if the dog is not housebroken. So I have a couple of examples down here as far as situations that you might wonder, okay, is that a valid reason for denying access to a service dog? And I understand we're in a webinar form, so you are able to be interactive with us. So I'll answer the questions for you. But allergies and fears of dogs. This is not a valid reason for denying access to a service dog team. In many cases, allergies are typically not an issue unless the person is coming into direct contact with the dog. There are some circumstances where severe allergies are an issue, but in most cases, say you're going to a restaurant typically cannot ask a service dog team to sit in any specific spot in the restaurant. They cannot discriminate in any way. However, if there is somebody with an allergy, that restaurant may be required to accommodate both parties, so having them sit in separate areas of the facility. And fear of dogs as well. the same situation. It is not a valid reason for denying access to a service dog team. An environment that must remain sterile, such as an operating room. This is a valid reason for denying access. This interrupts the nature of the service, and it is a direct threat to the health and safety of those involved. There are certain, the general public is not permitted to be into the operating room, so therefore a service dog does not have that necessary access. Individuals that are going into the operating room do have to take special precautions, such as, washing up and wearing certain gear to keep that area sterile. If a dog is unable to take the same precautions, they cannot enter. A dog's presence would elicit extreme distress to zoo animals. This is a tricky question that I trip up a lot of people when I ask this. The answer actually is yes, because again, it is altering the nature of the goods and services of the program. It is also posing a direct threat to the health and safety of some of those animals. There have been circumstances where we've been asked not to go near the wolf sanctuary because of the nature of their being. They are, prey animals. They prey on other animals. And there are situations where we might be asked not to go into a birdhouse place where the birds would have extreme distress and it could cause a health and safety issue for them. There have been another case where we were asked not to go around the area where they were trying to breed lemurs because it would disrupt that process as well. But if you ever have a question about whether or not it's a valid reason, ask more questions, have a conversation, and really figure out what it is and why it is that they are denying access. And if you ever feel that you have been discriminated against, you can always follow up with a supervisor, or you can file a complaint with the Department of Justice. So just like the handlers have different rights to take in their service dog into public establishments, they also have certain responsibilities. It is very important that we are taking into consideration the health and safety of others. We like to keep our dogs in good health, clean. Just as the previous slide mentioned, our dogs must also be under control. They should not be stealing things off the shelves, getting up on tables. They shouldn't be aggressive towards any other people or other dogs that might be in the area. But the ADA also does require that animals are to be under control using a harness, leash, or tether. However, there are some circumstances if a particular task that the dog must perform requires them to be off leash, the handler just needs to be able to control them with their voice during that moment. Dogs should also be vaccinated and have a current license according to state and local law. Dogs cannot be blocking a doorway or aisle. They should be kept out of the way for other patrons and staff. Things like an emergency exit, so important that we do not infringe on that in any way. Staff are not required to provide care for a service dog. So going back to the example of being in the operating room, or maybe being in long-term recovery where you're unable to take the dog outside to use the restroom, the staff are not obligated to provide that care for the dog. Some of them might be happy to. Some of them are dog people. They would love it, but they're not required. So in that case, the individual would have to make other arrangements for a friend or family member or dog walker to come in and assist if they are unable to do that. Another thing is to always be respectful when you potty your dog. Just like we like to keep our dogs clean, we also like to clean up after them. So if you're at a restaurant and there's a planter right outside by the entrance, we don't want to potty them on that. We might want to walk them a little bit further away and just be respectful of the facility, and then always clean up after them. We like to leave things better than we found them. Second. Okay. Now we're going to talk a little bit more about employment and education. So employers are required to provide reasonable accommodation, but if the reason the dog is needed is not clear, they can request documentation, which might include a description of how the dog would assist the employee in performing tasks. Service dogs may be excluded if they result in undue hardship or pose a direct threat to the workplace health and safety of others. So undue hardship might be, providing this reasonable accommodation would be very extensive, cost them a lot of money, that sort of stuff is to be considered. Schools, colleges, universities, they must allow individuals with service dogs into all areas that are open to other students. So just like what we mentioned before, anywhere that the general public is allowed to go. They may not require you to provide any documentation about the training, but they may require proof that the dog has vaccinations required by law. Transportation, trains, buses, taxis, Uber, all that covered by the ADA. You do not have to provide advance notice that you'll be traveling with a service dog, and they cannot deny you access to that transportation, even if there's a no pet policy. You cannot be forced to sit in a particular spot, but you may be asked to move if the dog is blocking an emergency exit. No additional fees can be required either. So this is also similar to staying in a hotel room. Okay, you don't have to provide advance notice if you have a service dog, and you are not subject to cleaning fees for the dog. However, if there's any damages done, just like they can charge me for punching a hole in the wall, they can charge you a damage fee for something like the dog ripping up the carpet or something of that sort. So that's just something to keep in mind. Transportation. I want to talk about this a little bit because the ADA and the ACAA and then the FHAA, they're all similar provisions, but they're applied a little bit differently due to the nature of the program. So they might have different definitions of what an assistance animal is. Just recently, however, the ACAA has aligned the definition of a service animal so that it's more in correlation with the ADA's definition. So that basically only allows trained service dogs, airline access. Emotional support animals are no longer considered an assistance animal under the ACAA. So that is something that has been allowed for a while, but especially due to the lack of training requirements, it has led to a lot of issues on airlines. So now they're treated just like a pet, where they can ride in the cabin if they can fit into a small carrier, or they have to ride in a crate in the cargo area, just like all other pets do. So the ACAA essentially is a law that makes it illegal for airlines to discriminate against passengers because of their disability. And it does require the airlines to allow service animals to accompany their handlers in the cabin. So some ways the airlines can determine if the animal is a service animal, similar to the ADA, I'm getting all these abbreviations. They can ask the same two questions, but they can also look for physical indicators such as a harness or tag. They can require a form that was created by the Department of Transportation that just confirms the health, training, and behavior of a service dog, and to attest to the toileting relief of a service dog that will be on a flight for 8 hours or longer. This form is pretty much the same across airlines. Some of them might have a couple of differences. When they first brought this out, it was stated that you only have to provide a form once a year for a particular airline unless their rabies vaccination expires. However, some teams that have flown have come back to us saying that they do require you to fill it out every time you fly. So, if you do plan to fly with your service dog, it is always good to check and make sure about that. And international flights are a whole nother story. But also by observing the behavior of the animal. We want to make sure that they are not posing any threat to the health and safety of others on the flight. So housing. The Department of Justice and the Department of Housing and Urban Development together enforce the Federal Fair Housing Amendment Act. So this is another provision that's a little bit different than the ADA. This requires housing providers, public and private, to provide a person with a disability reasonable accommodations. So again, this includes a modification to the no pet housing. This includes waiving any pet fee or breed and weight restriction. They are allowed to access all common areas where the general public is allowed, but it does not require the animal to be individually trained or certified. So this then includes emotional support animals. So they are considered a reasonable accommodation under the FHA and are able to accompany their person into a non-pet approved housing. Housing providers are entitled to ask for documentation of the disability and related needs if the disability is not readily apparent. So basically, for an emotional support animal, you would have to write a written request for an accommodation, and you would have to provide a written letter from a mental health professional that your animal is a emotional support animal, and this is how they help you according to your condition. Here's just some information about if you feel that you've been discriminated against, how you can file a complaint. So I know we've had questions about how to acquire a service dog or an emotional support animal or a therapy dog. So I have a couple of different things listed here. So as far as a service dog, as I mentioned, I always like to start people off by checking out the ADI website. There is a feature where you can narrow it down to certain states. A lot of organizations will place dogs across the country. We've got people out in Oregon and California. There are some organizations that are also abroad. So if you're moving or you know somebody across seas that are looking for a service dog, they can check out this website as well. But if you are looking, for another organization that might not be accredited, you can find them through a Google search. You can narrow down the specifics of what it is exactly you need from your dog and how they might help you on a daily basis. There are also self-trained dogs. They are, training a service dog is definitely a lot of work. You start them off early. You really have to put in a lot of time and effort to make sure that they are properly socialized and all that sort of stuff. So you can work with a local trainer that has some experience in this field, or if you yourself have experience training dogs, you can go ahead and go through that process. But that's also to say not every dog is meant to be a service dog. So, going through an accredited organization, they've already weeded those dogs out for you, and they do a very extensive matching process to ensure the dog not only performs tasks that you need, but is also able to keep up with your lifestyle, your interests. If you like to go swimming, you want a dog that can do that with you. These dogs are opening doors for our recipients, not closing them. So we want to make sure that we find the right dog for the right person. At Canine Partners, we do have an application process. Currently, it is closed to brand new applicants. But what that process looks like is you would come in for an interview after your application has been processed. You would meet with our trainers. They would get to know you a bit better, figure out everything it is that you need, what your lifestyle looks like, and what type of dog and personality you hope for. The waiting process is definitely the most difficult. We wish we could give a dog to somebody tomorrow, but that's just not the way that the matching process works. It really does take time for us to find the right dog for you. It's not always first come, first serve. But when a match is made, we have you come to Canine Partners for a 3-week team training. So during that, we teach you everything about grooming and healthcare, access laws, much more in depth than what we went over today. I was telling Tegan I could talk about this for hours. There's a lot more involved. But we also work on all of the different skills. We go on field trips with them to make sure that they're comfortable working with the dog in a public setting, handling the dog, we've had recipients that have never had a dog before, so just getting to know, even how to pick up poop with a poop bag. We really do get down to the nitty gritty to make sure that our teams are confident when they leave us. But again, with that follow-up support, our teams are never on their own. We are there to provide support every step of the way, even when it comes to that retirement process and easing our dogs into that transition. An emotional support dog, like I mentioned, for the housing, they would need to provide a letter written by a mental health professional. The websites that come up say, I want to register my dog as an ESA, those are not legitimate. You need a letter written by a mental health professional in order to gain housing with an emotional support animal. And then therapy dogs, some ADI accredited organizations do place these types of dogs similar to our courthouse and our residential dogs or facility dogs. But in some cases, they are also just self-trained dogs. Their handlers are volunteers that work with a therapy dog organization. Sometimes these organizations will have you come to their, facility to take classes with other members. So they do have a more extensive training process. But that's just one way that you can go forward with that process if that's something that you're interested in doing with your pet dog. So I know that there's a ton of questions coming up in the Q&A. So I do want to give some time for that because I like questions. They tend to bring up more discussion and we get a little bit more in depth about different topics.
Yeah, thank you so much, Cristina. That was incredible. So yeah, lots of questions coming in. Let's see. So first one here. So someone who's self-training their animal, is there a certification process the dog must pass, or even like guidelines or, certain criteria that dog has to meet to be able to be considered a service dog?
Yeah, so there is no widely known certification process for any of, it's not something that is required for a dog to present when they go out and work with their person in public. So we do have a public access test that we do at Canine Partners and other ADI accredited organizations, which if you're looking to self-train your dog, I think that's a really great thing to base off of to ensure they can hit all of those points to be able to work appropriately in public. There's videos on YouTube that you can follow a team going through that evaluation process, and you can find documents probably where you can follow the same steps. But they aren't required to work with any specific organization to go through a test and get, certified through.
Yeah, thank you for that. Yeah, having looked into this myself too, I know the American Kennel Club also has the public access criteria as well of all the different things that are, good to have.
Yeah, so they have a canine good citizen test. So
there we go. Yeah.
Therapy dog organizations will require the dog to be able to pass that type of test. It's a little bit different necessarily than the public access test, but it's definitely a really great accomplishment to strive for.
Definitely. So lots of questions about how to pay for a service dog. Are there scholarships available? How would you suggest someone raise the funds to be able to get a service dog? And also, does insurance ever cover the cost of a service dog?
So a lot of organizations like Canine Partners specifically, we only ask for a nominal donation when it comes to acquiring a service dog. So it might be $1,000 to $3,000, whereas a dog in the entirety of their training process actually costs about $32,000 to $35,000. We will never deny an individual a service dog based on their inability to pay. We would never ask them to pay that much. And we basically just want to make sure that they're able to afford the upkeep of veterinary costs and food and that sort of stuff. So that's really our main priority there as far as financials. A lot of other organizations are the same way. They don't charge their recipients at all for the dogs. Some of the organizations that aren't accredited through ADI do require a larger sum. And with that, I'm not sure most insurances will cover that. I think with veterans who might have insurance through the VA, they would maybe cover things like veterinary costs and that sort of stuff, but the upfront cost of a service dog would not be covered. A lot of teams will fundraise before they get a dog, so they might do a GoFundMe with friends and family who might be interested in supporting them through this process. So that has definitely been helpful for a lot of them as well.
And you were saying anyone in the country can access the programs through Canine Partners for Life, correct?
Yes.
Awesome. So as I was talking with you before, the disease burden for many types of dysautonomia is really similar to multiple sclerosis. So what kinds of benefits do you see MS patients get from service dogs that would also apply to the dysautonomia community?
Yeah, so some of the physical tasks of picking up items, opening doors and drawers, those are all tasks that help you conserve energy, so that you can put that energy into other things throughout your day, especially individuals who might have chronic fatigue, or maybe throughout the day they aren't able to function quite as well because they're losing some of that energy. A lot of our recipients that have multiple sclerosis, a lot of it is presented through physical limitations. So they might not be able to lean down and pick something up. So it's not quite so much the energy conservation for them, but for a lot of our recipients who do have cardiac conditions, that's a huge benefit on top of the alerting. The alerting is really something that has on many occasions saved lives. I mean, they can alert to an oncoming episode and give you enough time to sit down to a safe space so they don't faint and hit their head. That's something that has been one of our recipients who would faint multiple times a day, ended up going 8 months without a single fall. So that's been one of the biggest benefits of a cardiac alert dog.
Definitely. There's a study that came out really recently that falls is a really big problem for our patients. That's really helpful to know. Someone is asking if there's certain tasks that their service dog does, but like they only need it every couple months, every 6 months. How do you maintain your service dog's training, I guess?
I always tell people, practice it when you don't need it so you can use it when you do need it. I mean, our dogs, throughout the 2.5 years of their training, things just become muscle memory. I mean, we had a recipient who their dog was trained to walk alongside a wheelchair, but when she got him, she was able to walk with him with a mobility harness. And they've been together now for 6 years. And just recently she went back into a wheelchair and he picked it up like that. I mean, it is amazing how adaptive they are, but it is really important still to keep up with things, even if you don't need it in that moment, just to ask them for things. They think it's fun. It's a really great way to keep them busy, keep them sharp, and to bond with your dog as well. I love teaching them something new, even if it isn't useful, like taking a bow or something like that. It's just a really great opportunity for you to work with your dog.
That's awesome. Someone's asking, could service dogs alert detect dehydration or low salt levels? This is a huge problem with our patients.
That's a really good question. I'm sure they can. When we teach things like diabetic alert, what we do is we take a saliva sample. So with low salt level, I wonder if we could do the same thing. We haven't done that specifically at Canine Partners, but I could see that being a feasible task.
That's awesome. Yeah, it's just incredible to me how amazingly smart they are. So curious question, are some breeds more predisposed to being better service dogs than others, do you think? For someone who's maybe thinking about self-training and looking to, get a dog for themselves that would be how do they set themselves up for success in that way?
Right. Yeah. So at Canine Partners, we use Labs, Goldens, crosses of the two. I find those two breeds to be some of the easiest to train, and also the ones that just love to please. We also do have sometimes poodles. We like to incorporate them so that we can serve individuals with allergies. They are hypoallergenic. Um, their personality is definitely different. They are very, very smart, which can sometimes be a challenge if they're trying to play you a little bit, you know. Um, but also we've worked with shelter dogs, so we have had mixed breeds. Honestly, what we really look for is a solid temperament, good health, and size can be a factor as well, especially if we're looking for mobility dogs. We want them to be able to withstand weight bearing, that sort of stuff. Being able to be up and moving with their partner all day, even if they aren't a mobility dog, they're walking around a lot. They need to have good hip scores. So a breed that's prone to hip dysplasia, um, you know, they might be good for a while and then their working career might not be quite as long though, because as they get older, they do develop some difficulty with that. So we don't use German Shepherds in our program specifically, but a lot of guide work do. And different jobs also call for different personalities. Hearing dogs tend to be very um, energetic. They're very alert. They like to kind of be on their toes. Whereas sometimes service dogs might be a little bit more, I'm going to go lay down next to you while we're in class or at work, but I'm ready to go when you are. So we look for a lot of that type of things and personalities. There are dogs that can alert that are small dogs that others might look at and see, oh, that's not a real service dog, but really what they're doing is they're able to lick their person to low blood sugar, and that's really what that person needs. And if they're have the public manners and are providing this service for their person, they are a service dog and they have that public access right to be there. But I'm trying to think of any other, some organizations, I think Canine Partners or Canine Companions, when they first started, used corgis. It all depends on what job it really is that you're looking for.
What is the average wait time for service dogs? I'm sure it varies wildly, but can you give
It does.
give folks
It
an idea
does.
so they can have the right expectation?
Yeah, I think it depends on the organization, also how large the organization is, how many dogs that are really going through their program. At Canine Partners, our wait can be 3 to 5 years, which is part of the reason we closed our wait list, because we really want to make sure that we serve the people who have been waiting for 5 years before we try to take on more people and give them a false sense of when that dog will be available. We always suggest our applicants also apply to other places if they want to. Our main priority is that you get a dog, whether it be from us or from somewhere else. We know that that's something that you need, and we would love to support you every step of the way. But the wait time can really vary. And again, it depends on what it is that you need and when that right dog comes for you. So, alert dogs, something that's interesting is we can train our dogs to alert to diabetes because we can simulate that by taking a saliva sample. But, some cardiac conditions, some seizure conditions, we can't necessarily simulate what it is that they're alerting to. So what we actually do is we send dogs with a volunteer that has their own alert dog, and they keep them over the weekend and they compare when that dog alerts to their other one. So they get a sense of whether or not they have that innate ability. So sometimes alert dogs could be a longer wait just because there's more criteria that they need to be able to meet.
Someone's asking if you could share just a little bit more about the matching process. They're saying, some folks don't necessarily know what they need.
Mm-hmm.
So is that sort of something that, patients will get assistance with during the matching process?
Yeah, so we have an interview process with our 2 trainers. And so they ask a lot of different questions and they kind of go through your day-to-day life. And we do ask some medical questions just so that we can get a better understanding of where you're at with that. There are times where if episodes are very few and far between, it might be difficult to place an alert dog. We have a requirement. I don't remember if they've changed it, that you have to have maybe 1 to 3 episodes per month. And part of that is because a dog needs to experience some of that with you in order to be able to reliably alert to that. So if they're not getting that very frequently, they might not recognize it when it comes up again. So that is a criteria that we do look for when placing alert dogs. But they do go through the day-to-day activities, and they do talk about ways that your disability does affect your living activities. And we kind of get into the nitty-gritty of, okay, well, let's see what we can do as far as, what if a dog did this for you? How would that help? Or how would that make you feel? And what effects might you see? We've had recipients that have had benefits of having a service dog that they could never even imagine. They've been able to decrease medications. They've been able to get their driver's license back. They've been able to do a lot of different things that they never really thought was something that they wanted or needed.
That's so incredible to hear. A couple folks are asking about the case, for example, like in the case of 2 siblings that have the same condition, would it be possible to have a service dog that would support both of them, or is that not advised?
So a service dog is meant to work with an individual person, but that's a really good question, because I was recently on a webinar about autism service dogs. And so I don't want to go too off track here, but there was a question about a family that has more than one child with autism. And so they might place a dog with that family, and in the home environment, they work with both kids. But whenever they go out in public, the dog is focused on whichever one needs the most assistance. Now, when it comes to alert dogs, I would say they need to be working with just one individual. Now, the dog might alert to both of them just inadvertently because they sense this change and they need to let people be aware. So we've actually had a recipient where her son, she has POTS, and her son was starting to show similar symptoms, and she alerted to her son. And we talked about how to manage that interaction. So what we would do is we would allow the dog to alert. We would have the other person listen or respond, so that the dog knows, okay, they took note of it, they're going to take action and sit down. But any actual interaction or reinforcement or anything like that always comes from the individual that they're paired with. We actually have a 6-month bonding period when we first place our dogs, where nobody is allowed to look at them, talk to them, touch them, just to really reinforce that bond with them and to ensure that they are answering solely to them and that they are their primary person.
Someone's asking, what do you do if you're not able to travel for the training program? Is there an option to do that differently?
It will depend on the organization and kind of what their protocols are. There are some places that are more local, so you can look to find an organization in your area where you don't have to travel. But there are some places that will travel to you. Canine Partners, we don't do that. We do have the 3-week training program where you do have to come to Cochranville. But when you look through the ADI website or maybe on Google search and you find the organization, having that conversation with them and figuring out what route would be the best to take would be good. We always encourage an open line of communication, because we want to try to help people as best as we can, while also taking advantage of our resources and ensuring that we can provide that for them.
Can you give folks a little bit of an idea of how, when they're out searching for an organization to help them get a dog, an accredited organization, what are some signs to look for? And like you said, there's, as you know, there's many of the scams out there. What are some kind of red flags as well? So what should you look for, and what, in both positively and negatively?
Yeah. Well, when you do search ADI, you can be guaranteed that they are up to the standards of assistance dogs industry. When we get reevaluated, they check, they do a site visit. They check to make sure the area is clean and in proper working order. Our dogs aren't living in terrible conditions, that they're being treated ethically. They also take a look at all of our policies, practices, and procedures to make sure that we are providing the best possible services to our clients. So if you go through an ADI accredited organization, I can assure you that, they will have what you're looking for as far as professionalism and how they treat their clients. As far as what you're looking for in a type of dog, a lot of organizations will specify what type of dogs they place. If you're looking at places that aren't accredited, I would always recommending visiting in person. You can meet with somebody that works there, take a tour of the facility, and get a good idea for their the environment and the staff members and how they go about their program.
All right, sorry we're grilling you with questions. Do like maybe one or two more questions if that's okay with you, Cristina?
That's fine. Yeah.
Okay. So let's see. So for patients that are sitting there like, is this a good idea for me? Would this help me? What advice would you give them in deciding, and how would you qualify someone to say, yes, this would be good for me, this would help me?
So, well, when we look for qualified applicants, we do make sure that they have a documented disability and that this disability does have an effect on their daily living activities. So that would be something to look at as far as if a service dog is good for you. Think about what your daily living activities look like and what would you like to do and how could a service dog change that. Some people, if they would like to be able to take a shower on their own without having somebody on the other side of the door checking in on them, or be able to walk around the block without having somebody there with them. How would a service dog help me? Would their alerts keep me safe? Would their skills be able to give me the energy to do that? It's kind of a difficult question because you have to sort of self-reflect on that. Think about all the different skills that they can provide and how you might utilize them on a regular basis and how that might change some things for you as far as your level of energy or your other types of limitations that affect your activities. I don't know if I answered that super well, but
that's super helpful. Yeah. Let's see. I'm just poking through a couple more questions here. So someone's asking, because you were saying about the importance of bonding with your service animal. What if you're having a really, sometimes for our dysautonomia patients, they have really bad flares and are bedbound. Is it okay to have someone else assist with feeding, pottying, and basic care of their service animal?
Yeah, absolutely. Even so, like I had mentioned, we have the 6-month bonding period, but if there's a case where you're not able to provide those needs for your dog, you can have somebody step in and help with that. We just ask that that person does not, get too intimate with their interactions with the dog, excessively feeding them treats or that sort of stuff that might sway the dog to bond with that individual more than who they were placed with. So they can definitely have somebody assist. We just ask that they don't interact with the dog on that type of level, just so that we can maintain the bond that they've created with their partner.
Awesome. Just want to thank King and Spalding who sponsored this webinar series and made it possible. So yeah, thank you to them. And thanks again, everyone. And thanks again, Cristina.
Thank you.
Bye-bye.
Bye.